understand? So in this case, we deal with each condition separately. So preterm and all infant treated in a special way, keep in mind. Any question, please? No question? Okay. Beside the fluid, a major component of the calories, protein, carbohydrates, fat, the newborn needs important vitamins like vitamin A, D, and C. Of course, this is a major requirement for full-term infant. And to be discarding the fact that the body store of the newborn may be deficient with a lot of vitamins, especially the preterm. So this new human being need more supplementation with the fat-soluble vitamins A and D, and even water-soluble vitamin B and C. Preterm, and especially the extremely preterm, need extra amount of vitamin A, of course, to prevent hemolytic anemia. So premature in need more vitamins and more time for observation to meet their needs, of course, to give them immunity and prevent unwanted complications like hemolytic anemia, as we say. Special mineral and trace elements, of course, iron, full term with the well-nourished mother maybe not need iron immediately because the store may be enough, while newborn that delivered with a deficient mother in need for iron. So keep this fact in your mind. For a well-balanced motherhood diet and breastfeeding, iron should be added later on when you add extra or supplemental food. Folic acid need to be added for DNA and immune cell production. Fluoride should not be concentrated on this amount because most of infants develop fluorosis, that may be considered dangerous, so should be investigated more. Calcium and phosphorus, of course, human milk contain these two elements, besides the formula, of course, added in different concentration. This two material so important for bone growth and may be considered more important in preterm. So these special mineral, of course, its requirement for the newborn crucial, especially the iron and calcium plus phosphorus. Okay, we continue. Slide clear?
واضح دكتور.
Here we finish in general talk about the care of the newborn and its requirements, of course, in a brief way. Here we start with a new subject that we talk about the birth trauma. Of course, the newborn that come through the birth canal, or even the newborn that delivered by cesarean section, of course, not free of complications. So any newborn exposed to the birth trauma, the birth trauma can be avoidable and non-avoidable during the birth. So avoidable or non-avoidable trauma can present in different ways. The most important trauma that involve the head of the newborn, that to be considered the first part in the normal birth that come out. So we have a conjugate that considered cupped succedaneum. What we mean by cupped succedaneum? Diffuse edematous, dark swelling of the soft tissue of the scalp that extended across the midline and suture line, and seen, of course, after prolonged labor in full term and even a premature. More, of course, more in full term because the head comes to be more large. We have conditions that may happen in the same site, kefal hematoma. From its name, hematoma, it means there is blood inside. So kefal hematoma is a subperiosteal hemorrhage that does not cross the suture and be associated with skull fracture. With time, it may organize and calcified and may cause jaundice. Both caput and kefal hematoma are not treated better as a general. So all the time we can ask you about how to differentiate the caput from the kefal hematoma. As we see in the slide, the caput diffuse involve the whole scalp, so not limited by suture, and the skin of the scalp, of course, change to the blue, while kefal hematoma is the blood, not soft tissue swelling, while the caput soft tissue swelling. Caput may be associated with jaundice, may be associated with fractures of the skull. Of course, both of them self-limited. Kefal hematoma continued for a long time in comparison to the caput and may need follow-up to rule out the skull fracture. Retinal and subconjunctival hemorrhage, we speak about this in the previous slide. This is two pictures for newborn. The picture on the right is kefal hematoma. As you see, it's limited by suture. Of course, maybe unilateral or bilateral, while the picture on the left, the caput succedaneum, diffuse, involve the whole scalp. Important birth trauma, brachial plexus, of course, any pressure to the brachial plexus, of course, give us a different representation according to the site of damage. So involvement of the fifth and sixth cervical nerves give us what we call Erb's palsy or Erb's Duchenne palsy. Of course, picture gives us a painless adduction with internal rotation of the arm with absent motor reflex on the affected side, while the hand clasp is intact. Hand clasp so important in the prognosis. This is important in comparison to the next damage that we call clumping, that causes injury to the 7th and 8th cervical nerve and the 1st thoracic nerve. In clumping palsy, the hand clasp lost. So, in this point, it means the prognosis may be more worse, and the permanent damage may be the net result. So, Erb's palsy, better prognosis than clumping palsy. Clumping palsy that involve the lower cervical plexus may involve the sympathetic nerve that gives us what's called a hormonal syndrome, ptosis plus meiosis. Treatment of this injury, supportive as a general, include positioning to avoid contracture, active and passive exercise. Nerve graft may be needed, especially in the lower damage of the brachial plexus. But generally, more encouraged regarding prognosis completely from the earth pulse, while clumpic may be lived with some residual. This is a picture of the newborn with brachial plexus damage, adduction with internal rotation of the arm. Of course, in this case, we can send for certain investigation to the X-ray of the affected part to exclude fracture of the humerus, even clavicle, or dislocated of the shoulder joint. Another trauma that may be important, facial nerve injury. Of course, mostly lower facial nerve injury, result of compression of the seventh cranial nerve to the facial bone and the mother pelvic bone, and may be happen by forceps use. This is a peripheral injury that characterized by a specific cry, and the affected side is flaccid. The eye does not close completely. The nasolabial fold is absent, and the side of the nose is dropped at rest. If the central injury to the facial nerve, only the lower two-thirds of the face involved. So, the most facial nerve injury, the new one is lower, that involve the upper and the lower face of the face, both affected, while in upper injury, just the lower, of course, may be affected because the forehead may receive innervation from the contralateral side of the facial nerve. This is a picture of the facial nerve injury that mostly happened with the newborn. In this case, we have a right facial nerve palsy. The normal one is the left, that pull the weak one on the right, as you see in the picture. Skull fractures, of course, rare, and usually linear and require no treatment other than observation for a very rare delayed complication like leptomeningeal cyst. Depressed fracture that might affect the brain may need elevation. Clavicle is the most common fracture that may be faced during labor. and usually unilateral, and of course occurred in macrosomic infants. Macrosomic infant mean infants that are delivered with a large birth weight. Of course, decrease the movement and more flex may be affected. The prognosis is excellent and many infants require no treatment. As we mentioned before, motor flex should be done for each newborn. Motor flex may discover a clavicle fracture. Motor flex may discover a brachial plexus damage. Motor flex gives us a general idea about the activity of the newborn. So motor flex considered the most important. Primitive reflex should be done at the end of examination. Extremities, of course, exposed to fracture. The humerus, femur, may be involved in the problem. This is a picture of the fracture of the right clavicle. So the left clavicle, but the picture you see on the left and the right. So the left clavicle fracture, so clear in this picture. Visceral trauma. Should be suspected in all infants. That should be examined clearly. Liver, spleen, and adrenal gland, the most important that may expose to the trauma, especially in difficult or macrosomic and breech delivery. Rupture of the liver with subcapsular hematoma may lead to the anemia and shock and DIC. So, spend a lot of time to examine the abdomen when you see a pale newborn with abdominal distension. Infant with anemia and shock who are suspected to have intravenous hemorrhage, but with normal head ultrasound and normal anterior photon examination should be think about the splenic or hepatic rupture. So, a newborn with anemia, important to examine the anterior fontanelle. If you face a tense anterior fontanelle with pallor and even shock, you should think about intraventricular hemorrhage. Any infant with anemia and shock with normal intraventricular hemorrhage without umbilical hemorrhage, you should think about hepatic or splenic rupture. Infant with severe adrenal gland hemorrhage may exhibit flank mass, jaundice, and hematuria with or without, of course, shock. So, anemic or shocked newborn should be examined in detail for liver, spleen, or adrenal gland. Each of these organs give a certain few signs that differentiate this and from this organ. As we mentioned, intraventricular hemorrhage excluded by a normal anterior fontanelle. Adrenal hemorrhage may present with flank mass or hematuria or jaundice. So we have a little sign that differentiate these few internal organs that may need ultrasound to differentiate which condition or which organ involved. Any question, please? Here we finished the most possible birth trauma that may be happen to the newborn. Any question? Briefly, we talk about a certain procedure that can be done to the newborn before discharge. So if everything going well and your patient ready for discharge, we can send this newborn for simple procedure, metabolic screen. Every newborn should be sent for presence or absence of the congenital hypothyroidism and phenylketonuria. These two important should be discovered early, because if you discover and use the treatment, you avoid a lot of next complications. Other conditions that need screen: galactosemia, cystic fibrosis, sickle cell anemia, marble cerebral disease, homocystinuria, histidinemia. Of course, this is not available in all centers, so you can send what you have. Every newborn should receive a single dose of prophylactic vitamin K, 0.5 to 1 milligram of a natural vitamin K should be given after birth. This concept prophylactic, not therapeutic, because the dose of therapeutic vitamin K more than this dose. Prophylaxis of a gonococcal ophthalmia with a silver nitrate or erythromycin drop, of course, can be used. Important to mention this condition, newborn circumcision for boys. Of course, this has a medical benefit and advantage, besides little disadvantage. Benefit and risk should be carefully explained to the parents. Of course, most our society or locality, of course, goes with newborn circumcision for a religion cause, and of course for a medical cause. The benefit of the newborn circumcision: prevent inflammation of the gland and prepuce, decrease the incidence of penile cancer at adult, reduce the infection of the genitourinary system, while the risks local infection, bleeding, and pain. Of course, this is a simple and self-limiting side effect. All newborns should be vaccinated with the first dose of hepatitis vaccine. And if the mother is hepatitis B surface antigen positive, should also receive dose of hepatitis immunoglobulin as soon as possible after birth. So keep this in mind. Keep this in mind. If you have a positive mother for a hepatitis surface antigen, the newborn should be sent for screen. Immunoglobulin and vaccine should be given at the same time. Up to this slide, we can stop to be continue in the next lecture and to give you a time if you want to ask. So the time for you and question. شباب اكو سؤال؟ يا شباب
إن شاء الله ماكو سؤال دكتور.
ماكو سؤال؟
شكرا دكتور، إن شاء الله ماكو سؤال.
اكو اعاده فد سلايد معين، فد معلومه معينه نعيدها؟ يلا شباب